I want to stay with Deputy Commissioner Demora for a moment, and I want to just address very frankly an issue that has made a number of New York City families extremely angry and extremely concerned. You had mentioned when you spoke about healthcare surge, the wonderful job that the agency did building facilities in non-conventional locations. You mentioned the Javits Center, you mentioned the Brooklyn Water Terminal, you mentioned the Billie Jean King Tennis Center. Explain to me and really explain to the public then why those facilities would not have been used to house COVID-19 positive patients who were otherwise living in nursing homes, and why those people would have been sent back to nursing homes and not those facilities.
Nursing home facilities, as well as all healthcare movement, is controlled by the patient movement, is controlled by New York State Department of Health. So it was under their purview to give guidance on what patients would go where, especially from nursing homes, because that's directly under their purview.
But just as a practical matter, did the agency ever raise any red flags and say, "Hey guys, there's an available beds at these facilities. We spent all this time and money building these facilities. It's counterproductive that you would be sending those people back to nursing homes when we have those facilities." So again, were there any sort of red flags waved to your knowledge by NYC OEM or perhaps even New York City Department of Health or Health and Hospital Corporation?
Well, it's a general rule of thumb. We had coordination calls practically every day with Department of Health. New York State Department of Health was operating a evacuation coordination center at the Javits Center, so they were aware of bed availability, spaces that were able to be used, but it was ultimately up to the Department of Health of where those patients were.
Okay, so just to be clear, Department of Health was well aware of the problem of COVID-19 patients returning to nursing homes, but they were also keenly aware of the availability of beds in facilities that were designed to take COVID-19 positive patients. And this was all because of a New York State Department of Health guideline that, in my opinion, was issued on March 25th. I think that's the date. But that was all related to that particular guideline?
I believe so, yes.
So is it fair to say that an overwhelming number of COVID-19 deaths in New York City are attributable to some degree to this decision to return COVID-19 patients to nursing homes, and not the availability of beds that your agency and the federal government and other resources did a great job building?
Yeah, well, I would say there's probably a lot of factors. I'd just say on a positive note, we had supplied PPE to nursing homes. We tried to do the best we can to support them, but ultimately that policy decision was the State Department of Health.
But it was pretty clear, not even that late into the pandemic, that older New Yorkers and older citizens were particularly vulnerable to COVID-19, correct?
Yes.
Okay, so I just want to just be clear that many of the deaths that unfortunately befell our city were attributed to this insane decision to put the disease back into proximity with our most vulnerable population, into facilities that otherwise may not be able to have cared for them in isolation. But